Today we will talk about dryness in the vagina, which happens in immediate post-delivery period. I am Dr. Seema Sharma from Srishti Femcare, and today I will be answering most of your queries on why vagina gets dry after delivery and why a lot of people find sex very painful in the immediate post-delivery period. Now, it's a fact that, once you have had a vaginal delivery, your vagina will become lax. It will become more open, and you would think that, yes, sex would become easier with a lax vagina. But what happens is when you try and have vaginal sex, you find penetration very difficult and it is painful. So, इसके दो रीज़न हैं. एक तो जब आप ब्रेस्ट फीड करते हैं तो आपका बॉडी में प्रोलैक्टिन हार्मोन का लेवल बढ़ जाता है. सो प्रोलैक्टिन हार्मोन का एक साइड इफ़ेक्ट है कि अच्छा इफेक्ट तो है कि आपकी ब्रेस्ट मिल्क की सप्लाई बढ़ जाती है, बट द प्रॉब्लम इज़ दैट इट ऑल्सो कॉजेज वेजाइनल ड्राइनेस. So we usually recommend to our couples that when you initiate sexual activity vaginally, you must go slow and you must use a lubricant to penetrate. Otherwise, there would be pain, and your partner is not going to like it, because if you have pain while sex, obviously sex is not going to give pleasure to her. So use a good lubricant, which is a water-based lubricant. आप एक सेक्सुअल इंटरकॉर्स में कितनी भी बार ल्यूब्रिकेंट को इंक्रीज कर सकते हैं. आप बाज़ार में कॉमनली अवेलेबल ल्यूब्रिकेंट, आप सलाइवा, आप KY जेली, आप ल्यूब्रिक ऑइंटमेंट, एनीथिंग कैन बी यूज्ड. ये जो ल्यूब्रिकेंट होता है आप इसको अपने प्राइवेट ऑर्गन्स पे लगा सकते हैं, पीनिस पे, या फिर आप वल्वल लिप्स के अराउंड लगा सकते हैं, सो दैट पेनिट्रेशन इज ईजियर. इनसाइड द वजाइना इज रूमी, लेकिन जो बाहर का पोर्शन है वो आपके पार्टनर को पेन सेंसेशंस दे सकता है. सो दैट नीड्स टू बी टेकन केयर ऑफ. सो ड्राइनेस इज बेसिकली बिकॉज ऑफ इंक्रीज इन द प्रोलैक्टिन लेवल, एंड ऑल्सो साइकोलॉजिकली when you have a new baby sleeping next to you, baby is you're worried about not disturbing the baby. You half your mind is on to, okay, now the baby is going to get up and you have to feed the baby. So all the emotions are not yet there. So I definitely recommend, so you need to make more couple time together. So when you have relations in immediate post delivery period, either try and have somebody else take care of the baby during those couple of hours, or you put your baby not next to you but in a separate baby bed. So physically the baby is not moved when you are together. And also try and have relations in after breastfeeding. So your breasts are not heavy, you're not leaking because of the sexual excitement. Your breasts they start oozing more milk when you are sexually excited. So the dryness that a lot of women feel in the immediate post-delivery period is because of natural hormone prolactin. Also, then it could be infections from your vagina. The stitches have healed with a lot of scar tissue, and when you stretch this vagina, it causes a lot of pain and it causes the feeling of dryness. And if this commonly happens once your episiotomy has healed into probably a month later, that is the time when scar tissue is tender and you might feel a stretchy feel of dryness in that area. So you could use an ointment in your scar area, or if it has already become a thick scar, you would visit your gynecologist, and who would recommend a lot of treatments are now available, including injections into your scar tissue, including the use of lasers into your scar tissue, and this can take care of it. But dryness is very common. Coconut oil application helps, use of water-based lubricants help, avoiding harsh soaps will help, and you can just use any over-the-counter or cocoa butter creams, which are aloe vera creams, which are very, very useful for taking care of this dryness. So do not assume just because of a normal delivery your vagina has become lax, so you cannot, and actually your vaginal discharge may be more. On the contrary, your skin might be drier. So which is all part of normal post delivery changes, and you can take these small steps to overcome them and have uh, more sexually gratifying physical togetherness. Please take care of yourself. That's all for today.